All right, back in the zone. We know we got all kinds of things here. I see a blood pressure cuff and all kinds of problems that are arising because of it. Because right now we are getting research into the newsroom about brain health, and researchers looking at more than 7,000 people who kept their blood pressure about 120 systolic for 3.5 years. The results showing these people had lower risk of mild cognitive impairment or even dementia. Dr. David Shaker joining us now to break it all down. Dr. Shaker, good to see you. I feel like blood pressure is always like the baseline, right? You go into the doctor, they take your pressure, and then from there, everything evolves. And it seems like this research is saying that.
So this is huge. A lot of people think that the only reason we check blood pressure is for cardiac health and strokes and things of that nature. But the truth is, reduction in blood pressure, especially in that middle age region between your 30s and 40s, can strongly reduce how much brain decay, we'll call it, if you will, you can get in the future. And that we kind of turn that in the future mild cognitive impairment or delay, which then can later on progress to dementia. You know, when it comes to the blood pressure, the biggest reductions that you can make are upfront, and you can have almost a 15 to 20% reduction in that cognitive impairment or dementia. You can use medication, or there's exercise and other tactics that people can use. I would start by, number one, paying attention to it, getting in to see a doctor. You can go to your regular pharmacy. And I love when patients have these monitors for themselves at home, and we can have the conversation going forward with them.
And I think that's a key point, because 120 is not achievable for everyone. People who get older, people who have high blood pressure in their family, et cetera. If you can use medication to keep your blood pressure at those levels, this still applies the same for the brain?
So, yeah, and I want to rephrase it. 120 isn't achievable. You want to make sure that you're doing it safely. Some people, if you overshoot their blood pressure, they can get symptoms, but the goal should still be a blood pressure of 120. We want patients to be able to check their blood pressure at home. We want them to come and contrast that when we have it in the office. And it's important to be paying attention to medication and other tactics. So, yes, I'll provide you with the medication necessary when it comes to if we need to lower your blood pressure with that tactic. But what can you do at home, right? Number one, we're always encouraging about 150 minutes of exercise throughout the week, and that can reduce your blood pressure by about 5 to 8 points on its own. There's the DASH diet, which is high in fruit and low, particularly in salt. That's the big issue. Weight management will reduce the blood pressure, reduce inflammation, and improve overall brain health. And then reduction in your overall alcohol, smoking, how well you sleep, stress management. Those things are huge. They're key. And they're areas that we can augment up front when you don't really want to take medication later on in the future.
All right, Dr. Shaker, keeping us on point there. Get that blood pressure down, and it also affects the brain. Big news there from researchers. Thank you so much.